Hey everybody, and welcome to Tales from the Clinic. This is a new podcast hosted by Dr. Molly O'Banion and myself, Ashley, just a regular gal. The premise of this podcast is all things pets and veterinary medicine. Dr. Molly is here to do that part. I am here to make sure she's using words us regular people can understand. Each episode we will dive into different aspects of veterinary medicine, interesting cases seen at the clinic, and just general advice on pet ownership in hopes of educating and giving a glimpse into our world. So, let's get started. Hey everybody, good morning, good day, good evening, whenever you're tuning in to us today. We are talking about, we decided we want to kind of be on theme with all of the holidays coming up. And we are going to start, since Halloween is going to be happening tomorrow, we're going to start with kind of hidden dangers amongst our goodies that we have during the holiday season. Oh, you have to face the mic.
Spooky.
Spooky. So we are going to mainly talk about things to be aware of for Halloween. Of course, sweets and treats and whatnots do carry into Thanksgiving and Christmas as well. But we're mainly going to be focusing on the yummy stuff, the chocolates and the num-nums and the yum-yums.
Num-nums and yum-yums are the same thing.
And yum-yums. That's debatable.
Gosh. So I guess I'm going to go into the science of why.
Okay.
And then you give your reaction, just like always.
Just like always.
There's nothing new.
Oh, I love my job. I just get to react to things happening to me.
It's like theater.
Do I prepare? Never.
Never. It's all a surprise, just like y'all. Okay, so chocolate. Everybody knows that chocolate's toxic, right? That's not a surprise. Everybody knows. All the cool kids.
All the cool kids know.
All the cool kids know. But why? What aspect of chocolate is toxic?
I figured it's a concentration of the cocoa. Because I know it's the certain degrees of chocolate. From there's
like
white
hot versus
chocolate.
cold?
No, it's I thought it was just the concentration. So I think white chocolate's not bad, but dark chocolate's worse. So I figured it's the chocolate concentration.
Sure, but what's in that that's toxic?
Cocoa.
You're doing great. You're so pretty. Okay, yes, it's the bean, but in the bean is caffeine. That rhymed. I'm punny today.
So it's a caffeine.
It's the caffeine and the theobromine, but it's the caffeine.
Oh.
So don't give your dogs coffee.
Don't give... Okay.
Or Monster energy drinks. Or
technically no one should be drinking energy drinks, but that's okay.
If you want kidney stones, that's your own deal. Okay, so yes, the degree, I guess, of chocolate does matter. So if you take cocoa beans, just cocoa beans, if your dog gets into your coffee supply, the milligram of methylxanthine, which is the toxic component, per ounce can be anywhere from 300 to 1,500 milligrams.
Okay.
And then you have your unsweetened cocoa powder, which is 800 milligrams per ounce. And then you go to your dark, baking chocolate, and that's 400 milligrams per ounce. And then you go to your milk chocolate, which is 64 milligrams per ounce. And then you go to your white chocolate, which is less than 1 milligram per ounce.
Oh, okay.
So white chocolate's probably not a big deal. Milk chocolate's takes a lot, unless it's a tiny little chi-hui-hui. And then the dark chocolate and the coffee, bad news bears.
Got you. Now, that's not saying white chocolate. Don't give white chocolate to your dog.
Please don't. The sugar and the oils and stuff is also not good. But we're not as worried about the chocolate toxicity aspect.
Yeah. So let's say, because, we've had clients come in and this happens. You have your counter surfers. If you learn that your dog or cat, any animal, ingested chocolate, let's say it is darker chocolate or a mix of, what what do? I know you make your dog throw up at home, but that's not always safe.
Mm-mm. Can I pause for just 1 second?
Yeah.
Whenever I hear the word counter surfer, I guess it's a phrase. Whenever I hear the phrase counter surfer, which I hear it all the time, I always imagine a dog standing on its back legs in little like board shorts on a surfboard. And I can't help it.
I'm going to get you a sticker.
That's what's actually happening in my brain. And then I am listening to you, but not really, because I'm imagining the dog surfing.
You got the Beach Boys in the back of your head?
Yes.
Yes.
Okay, but yes. So, actually, what did you say? So
Wow. So you can't remember.
Yes. So what do they worry about? We make them vomit. So
Yes.
actually, if you're close to an ER, like within 30 minutes, or a vet clinic that can handle it, that's best. Don't
Okay.
make them vomit. If you're 30 minutes to an hour away, then it's best to make them vomit, because within an hour, it's already been ingested.
Okay.
And then you can start having toxic side effects. But making them vomit at home, the ways that we make them vomit at home can also have complications.
Yeah.
So let's talk about that.
Okay.
There are 3 main ways that we make dogs vomit at home, right?
Mm-hmm.
So number 1, sticking your finger down their throat. What? You're probably going to get bit, but power to you. That's probably the safest for the dog. I don't find that it works that well. And it's probably not the safest for you.
Yeah. I don't know if I've ever heard a success story with that one.
Yeah, but power to you. The second is pouring a bunch of salt down their throat.
Ugh.
Like taking the salt shaker and going like this. Bleh.
That's awful.
It works. You can cause severe dehydration. Pretty bad. That's probably not a good thing.
So then they need fluids.
Yeah. The third, and probably the most common, is pouring hydrogen peroxide down their throat. And yes, it works.
That sounds like ulcers.
But yes, ulcers. You get ulcers in their mouth, ulcers in their esophagus, ulcers in their stomach. So you're causing a whole other list of problems.
Ugh.
But if you know they're going to get chocolate toxicity,
Oh, it's kind of the worst monster.
you're stuck between a rock and a hard place.
Yeah.
Right? So, like...
Between a ghoul and a zombie.
Yeah. Spooky. Like, weigh your risk versus reward. But if you're within easy-ish reach of a vet clinic that can handle this problem for you, we have drugs to do that.
Oh, yeah. It's actually very interesting because the drug that I know, at least we use here, it's a eyedropper. And you put a drop in the eye, and somehow that induces vomiting. I don't understand the science, but the drop in the eye makes the animal vomit. Does it do the same to humans? I guess you obviously haven't tried, but...
I don't know. Humans are gross.
Humans are gross.
The ones that we use for cats are an injection, and then we have to spin the cat around in a chair.
Oh, I've seen that one.
It's really fun.
That one's funny.
One of the vets that works for us, her cat ingested a obscene amount of onions recently. Like, bad. And so her husband brought the cats into work, and she was trying to make the cats vomit because she didn't know which of the two had ingested it. And so her husband was in charge of the spinning because she was handling patients.
Mm-hmm.
And so he was sitting on the chair trying to spin them with him. And so he was getting dizzy.
What?
Just put him in a kennel and spin him in the... Whatever.
Husband's like, I got this.
Oh my gosh. Okay.
So let's say they make it. We induce the vomiting. What else
Next
would you
steps.
do? Yeah.
So technically, the half-life in caffeine for dogs, is about 4.5 hours. So
What does that mean?
it means even if we make them vomit, they still could have absorbed some of it, and we may not see side effects for 4.5 plus hours.
Gotcha. Okay.
So what we like to do for these guys is we like to, at minimum, keep them on IV fluids, support any symptoms that show up, and monitor them for like 24 hours at minimum. And the symptoms that we usually see are like central nervous stimulation, so like seizures and stuff. We can see increased heart rate. We can see nausea, vomiting, diarrhea. We can see smooth muscle relaxation in the bronchi, so trouble with breathing.
Jeez.
Yeah, it's really fun. It's really fun. And of course it matters like how much of the chocolate, what kind of chocolate, the size of the dog, all of that fun stuff. So that's why, and some of those things can be pretty severe. Like if they get increased heart rate and start having trouble breathing, you can't handle that at home.
Yeah.
Like you can't. Like sometimes we have to stick them on a propofol CRI and a phenobarbital CRI to keep their heart rate down and keep them from seizing for 24 hours.
Yeah.
Like you can't do that at home.
Yeah.
So if you want to keep your dog, they need to stay on monitoring.
Yeah.
If you think that it was a bad dose.
Yeah. Ugh.
Mm-hmm.
Okay.
If it was white chocolate, you're probably fine. But good news, prognosis factor. So this is one report. In a report of 44 dogs with chocolate toxicity, 43 of them were successfully treated and discharged, and only one of them died. And the one of them that died had 64 milligrams per kilogram of theobromine and 19.7 milligrams per kilogram of caffeine, which is pretty freaking a lot. And it didn't present for treatment until 12 hours after the ingestion, which is a long time.
Yeah.
So that it was not able to induce vomiting. It did not get the necessary, treatment. And by the time it already got to the hospital, it was already tachycardic. It was already hyperthermic. It had already started seizing. So,
yeah.
Like that one was already pretty severe.
Yeah.
But the others, like that's fair,
Yeah.
But the others, like 43 of them survived. So if you do the right steps, the chance of survival is pretty high.
Yeah. But according to the report, veterinary professionals were involved in that.
Yes.
Specifically saying, don't do this at home.
Don't do this at home.
Don't do it at home.
Okay, let's go over xylitol.
Xylitol.
Which is the other candy. It's actually called chewing gum poisoning.
Chewing gum poisoning.
That's what the kids on the street are calling it.
Oh, yeah? Because you're hip and fresh, you know that?
Yeah. Actually, it says on my thing.
So I know xylitol is used in caffeine-free gum, or they put the flavor in gum.
Sugar-free.
Sugar-free. There you go.
Sugar-free. So it's a 5-carbon sugar alcohol that is in a lot of plants and mushrooms. So it's like a natural sugar.
Okay.
But not like a fruit sugar. It's like a plant sugar. Like leaf sugar.
Yes.
Num, 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 num,
It's
num,
a
num.
leaf sugar.
Num, 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 num. It says it's through extraction and processing of xylan from hardwood trees.
Ah, of course, as is tradition.
Chew on them trees, girl.
Chew on them trees.
It's really gross. That's really gross. Same level of sweetness and 40% fewer calories. Because you're chewing on trees. I am also guilty of ingesting xylitol, so I can't judge. But
I thought you were about to say you're guilty of chewing on trees.
no, well,
okay.
I guess, obviously. So it says that, and when I say it, I mean my little cheat sheet here, because I'm not a xylitol expert, except for in the treatment aspect. Xylitol is used in greater than 1,900 food and non-food products, including sugar-free foods, which is what we usually see it in. So candy, baked goods, jelly, condiments, syrups, flavored drinks. So probably your Gatorade mixes and stuff like that.
Oh, yeah.
Probably that. Peanut butter, that's a huge one.
That's the big one.
So that's a big one. People use peanut butter a lot to put medications in, but they don't realize that some peanut butters have xylitol in them. So please go home and check your peanut butter label. It will be in the ingredients label. It'll say xylitol. And it's spelled XYLITOL, xylitol.
And there's one brand that you know is okay.
Jif. Jif is fine.
Jif is okay.
I don't know about anybody else. I'm not a peanut butter expert, but Jif is fine.
Jif is fine. Okay.
We should get sponsored. Protein bars. Oh, it also says nut butter, because apparently that's different than peanut butter.
Yes, it is, because I'm allergic to the nut butter. Tree nuts.
But you can chew on bark.
Well, I'll go and try that then.
Yeah.
Yeah.
Okay, so the non-food products, and I'm reading this, and this is kind of gross. Toothpaste. Don't feed your dog toothpaste, apparently. But they make dog toothpaste. So the dog toothpaste, I'm sure, is probably fine.
I guess that actually is a good point because
Yeah.
people at home dental management don't use human toothpaste on animals.
Yeah.
Yeah.
Medications, yes. So when we say give your dog a children's liquid medication, make sure that liquid medication doesn't have artificial flavoring because that artificial flavoring may have xylitol.
Oh, I get you. Oh, you've also clarified this about Pedialyte, I think.
Yes.
You always say the OG, no flavor in it.
The plain, boring Pedialyte that nobody actually buys.
Yeah. It's good for dogs.
It's good for dogs. When you use Metamucil, people put Metamucil in their dog and cat food for constipation. The plain, boring Metamucil. Don't use the orange flavored one.
Okay, got it.
Duh.
Yeah.
Everybody knows that. Now. Apparently, xylitol is also in cosmetics and deodorant. Don't feed your dog deodorant. That's gross. And sunscreen.
Don't feed your dog sunscreen.
But people put sunscreen on their dog's noses, so maybe that's a good thing to know because...
Oh, that's fair.
Like, if they lick their nose, that's...
Yeah. Don't let your dog lick you after you apply...
Disposable diapers?
I don't think anyone should be eating disposable diapers.
Why do diapers need to be sugary? Is there something that we're missing?
Maybe it's part of the water barrier thing for the blowouts.
I don't like it, and we're moving forward. Hair care products. Also, don't eat those on a regular basis. Don't hairspray your dog, because they will lick it off, and it might have xylitol. Cool. PSA. Okay. Ta-da! Oh! Because of its humectant, cooling, and antimicrobial properties, it's also a component of some types of clothing, especially sports clothing.
So...
Have you ever chewed on your sports clothing? Apparently it's sweet.
Huh. I'll have to ask a professional sports ball person on that one.
I'm learning so many things.
Okay, if your dog well, I guess there's multiple layers to it. If your dog eats your sports clothes,
Panic.
xylitol, but also foreign bodies, so it needs to come out either way.
Oh my gosh. Okay, so xylitol's everywhere. Everybody be scared.
Everyone would be terrified.
Okay, moving on. I can't. Okay, let's go over the pathophysiology. This one is interesting because considerable species differences exist. So it affects all of our animals differently. So, like, obviously in humans, we're fine. And it sometimes causes cancer, but we don't care. Cancer's everywhere. The sun causes cancer. Our air causes cancer. It's fine. It's not, but it's fine. So, in humans, it's okay. In horses, it's okay.
Okay.
So you can feed your horses gum, but don't. But it's fine. In cows, rats, and goats, it releases insulin similar to that in sucrose. So they stimulate a response similar to normal sugars.
Okay.
Ours is less than normal sugars.
Yeah. Okay.
In rabbits, it's a higher level of insulin than normal sugars.
That's bad.
Yeah, so like if you gave them a ton, it would be bad because then they would get hypoglycemic. But I'm pretty sure it'd probably take a ton.
Yeah.
In cats, it's even more. So cats, bad. And then in dogs, it's like exaggerated, which is why they're so bad news bears.
Bad news bears.
Bad news bears. So cats and dogs, number 1. Rabbits, number 2. Everybody else, chilling. Yes? And that's what makes it so dangerous, is it stimulates the insulin to come out of the pancreatic cells, which causes hypoglycemia.
Gotcha. And can we treat that?
Yes.
I mean, I know, like, obviously same thing as the chocolate. Make them vomit if you can. Yes. Although, how do you vomit up peanut butter?
It works. I mean, you can still get... Even if you get some of it out, you're decreasing the dose of xylitol you ingested.
Okay.
Right?
Yeah.
Because, like, less is more.
Yeah.
So, hypoglycemia, first of all, is low blood sugar, for people that don't know that. So, like, low blood sugar is bad, right? Because your body lives off of sugar. Like your cells cannot function without sugar. And if you don't have enough sugar, you cannot function. And then you start seizing and you can't breathe and you go to liver failure and you go to kidney failure and you just die. The end.
I don't like that ending.
I guess. So yes, induced vomiting, number 1. Number 2, fluid support. And in that fluid support, we add sugar.
Oh, okay.
So we put dextrose in the fluid bag at a normal pathophysiological concentration. So at a normal body concentration.
Thanks.
Yeah. Her face.
I'm like,
Great.
deer in the headlights.
So when you're pumping fluids into the body, you're pumping sugars that would equal the normal sugars in the bloodstream.
Gotcha. And then also with the fluids, is it, and it might be a combination of both, are we trying to speed up the system to flush it out, or is it diluting it? Or is it both?
It's more supporting until the xylitol effects wear off.
Okay.
If that makes sense.
Yeah.
Yeah. So insulin can also have pretty profound responses on a lot of our electrolytes. It can really mess with your calcium and your potassium and your chloride and all sorts of things.
Ooh. Like permanently or temporarily?
Temporarily.
Yeah.
But it can be dangerous. So a lot of those things are responsible for your muscle moving. So like your potassium is responsible for your heart muscles pumping.
Yeah.
So if it's wrong,
your heart's important.
Your heart's wrong. Bad. Not good. So we need to, if we think that a xylitol ingestion could be dangerous and we didn't make it vomit in time or enough, we need to run blood work so that we can see how bad those electrolytes are being affected so that we can correct what needs to be corrected for life.
For life.
For life, period. That's as simple as I can get it. I don't know how to get it.
And is that one where, because I know like with garlic and onion, you'll do initial blood work and then in like 3 days you do blood work again. Do you need to do that with xylitol?
Its half-life is much shorter.
Okay.
So it depends. It always depends. Medicine's
always
great,
depends.
Right? So it peaks a lot sooner. So like it's the first 8 to 12 hours that we're most concerned about. But if the damage is enough, so like if it causes significant liver damage, then I need to monitor that liver damage for a longer period.
Yeah.
If it doesn't get to the liver damage stage and it's just the hypoglycemic stage and maybe a little bit of hypophosphatemia, then it's probably fine.
Okay. Cool.
It depends.
It depends.
I need that sticker on my forehead.
Yeah.
So I can stop saying it so often.
We could get you a new tattoo.
Yeah. Can I put it like on my hand, and then whenever somebody asks me a question, I can just like hold my hand up. Like it depends.
No, we should get you bangs, and you can do
just
it on your
move
forehead.
My bangs across.
Just lift them up like a curtain.
Okay, so another really fun thing that it can do is it can cause anticoagulation effects.
Ooh, I know that one. We checked that before surgery. Blood clotting issues.
Yes. So what happens when you cause enough anticoagulation effects? Because your blood clotting is not just for wounds. Blood clotting is happening all the time in your body. It is lining all of your blood vessels at every moment. Right now, you're clotting. Did you know that? Yeah, take a look.
Look at all that clot.
Guess what happens if it stops?
I fall apart?
You start leaking.
From where?
Everywhere.
Oh no. That's spooky.
Spooky. So literally, if you have enough anticoagulation effect, you can start leaking blood from all of your orifices.
Ugh.
And then you die.
And that's, I'm assuming there's not really a way to stop that one.
It's called DIC. The survival rate is probably about 20% or less. Some of them can pull through, but it's not very common.
What about quality of life after that?
If you can pull them through, they're okay.
Okay.
But that's an if.
Yeah. Ugh.
It's great. It's fun stuff. Okay, so the basis of xylitol is make them vomit and then support them for 12 to 24 hours after you run blood work. And prognosis, as long as they don't go through like the clotting issue, pretty decent. Pretty decent.
Pretty decent. Okay.
As long as they don't go through the product issue. Or unless their liver fails, then you can have prolonged effects. But they have to eat like a lot of it for that to happen.
Yeah.
But don't feed your dog gum or sunscreen or diapers. Oh, gosh. Okay, so let's kind of shift to, I guess, a little bit less of Halloween and a little bit more of Thanksgiving. So when we start thinking about Thanksgiving toxicities, we start thinking about more of like cooked meals type food and less candies.
Right.
Right? So we start thinking about a lot of like onions and garlic, which, rewind back up a couple things. We talked about it. This is a commercial for a couple episodes back. Go listen.
Go listen.
But another one that we think about are grapes.
Grapes.
Right?
Charcuterie boards.
Charcuterie boards. Grape salad. Yummy, yummy. So not everybody, a lot of people, I actually have a lot of people that say, I feed my dog grapes all the time. And I'm like, why? Don't do that. So grapes are not good. But grapes, it's not just grapes. It's all members of the Vitis vinifera species.
I don't know what that is.
It's raisins, sultanas, it's currants, it's grapes, yes.
Okay.
It's grapes and its cousins.
Grapes and cousins.
Yes. What in the grape is toxic?
I've heard different things. I've heard that it's the seeds, so if you get seedless grapes, it's perfectly safe. I've heard others say that it's the skin, so if you peel a grape, it's fine. I've never tried to peel a grape. That seems really difficult and not worth it. I'd rather just buy dog treats.
It probably is easier. Yeah. I don't know that we've really, nailed down. There's been a lot of theories, but nobody fully knows. We do know that it's the fruit. It's not the leaves, it's not the vines, it's not the oils, it's the fruit.
Yeah.
So if you're feeding, grapeseed oil, it's fine.
Please don't feed your dogs oil.
Please don't. Please don't. But that means it's probably not the seeds, right?
Right.
So I mostly hear that it's the skins, but we haven't ruled out that it's not the body of the fruit. So just don't.
Yeah. Man, there was one time, I can't remember. Oh, I think it was within the last year. I think someone had to bring their dog to the EC because they were training their dog, and the dog worked really well with grapes, and they gave it 20 to 30 grapes before they I don't know, they just randomly decided to Google it after 20, being like, is this safe for my dog? And I'm like, wouldn't you Google that before?
Can we switch to blueberries or strawberries?
Ooh, blueberries.
Yeah, that's fine.
Those are fine?
Do that.
What about the sugar content?
It's fine.
Okay.
Blueberries are small enough. It's fine.
Okay.
If you're using them for training treats,
yeah,
it's fine. So we do know that it is most likely, the tartaric acid and the potassium bitartrate salt.
Okay.
Most likely. Which grapes and tamarinds have the highest concentration of these. And it mostly affects the kidney.
Good morning.
It mostly affects the kidneys. My goodness. I can't. I can't. So, fun fact. Most of your jams and wines are detartrated. So they're not toxic.
So I can give my dog wine.
Don't do that.
Yeah.
But because of the alcohol content, don't do that. But if your dog drinks wine, we're not worried of the grape issue. We're worried of the alcohol issue. If your dog eats grape jam, processed grape jam, not just grapes smushed in a jar, we're not worried about the grape issue.
Gotcha. Okay. But the alcohol issue, which I guess that technically could be a point. Some people think it's funny to give their dog some beer.
That's another topic.
Another topic?
We'll do that one with THC.
Okay. I like that idea.
Yeah. Because that's kind of...
Topic. Animals don't party.
Yeah! Animals as your DD.
Please.
Oh my gosh. Okay, so what happens? I said kidneys.
Uh-huh.
Yes. So kidneys are the main one, and kidneys just aren't really forgiving organs. That's a funny sentence. Like, kidneys aren't ones to, they hold grudges.
They hold grudges.
Yeah. Yeah.
Don't piss off the
Oh
kidneys.
my gosh. And this is one of those that you can have issues days after. Like, it doesn't happen within the first couple hours.
Okay.
Within the first hour, we need them to vomit, and you want to be able to count the grapes if possible.
Yeah.
Which, I don't know how many times you eat grapes and it's like, this bushel has 20 exactly.
1,
Yeah.
2, 3.
Yeah. Oh no, my dog ate 15 and a half. No. No. So that's a problem because we don't know how many, Like,
yeah.
that's not ideal. But we want them to vomit as many as possible. And then we do blood work to check kidney function as a baseline because they probably won't have kidney issues at the start.
Gotcha. Okay.
And then we're going to check it in 48 hours. And then we're going to check it in a week. And then we're going to check it in 2 weeks.
Okay.
So that we can monitor progression. In the first 24 to 48 hours, and this is how I practice, every vet's going to be different. But in the first 24 to 48 hours, I like to keep them on fluids to help support the kidneys. And I like to keep them on supportive medications. So I like to give them activated charcoal to try to line their GI system to decrease the amount of grape that's absorbed.
Okay.
I like to kind of flush their system to help kind of support the kidneys as much as possible. I like to keep them on liver protectants just in case. And there are some theories that keeping them on calcium carbonate, which is essentially Tums, can help decrease the amount of calcium tartrate, which is the toxic ingredient that is being absorbed too.
Interesting. Don't rely
on it.
Yeah.
But like if I can add that on, Tums isn't going to hurt anything. Even like if you think your dog ate some grapes and you pop a Tums in their mouth on the way to the vet, sure. Great. It might help. Who knows? It's not going to hurt. There you go. There's your tip. Okay, so prognosis. You ready?
Yeah.
In one study, this is one study again, of 139 dogs, they couldn't have found one more. I hate that number. That's a horrible number. Okay, in 139 dogs with grape and raisin, kidney disease developed in 6.7%. 138 of them survived and 1 died. Why is it always 1? One of them always dies. In another study of 95, 14.7% of them became symptomatic. Only 1 of them developed kidney injury. All of them that were induced vomiting survived. In a third study of 606, man, those people did the thing, that presented to an emergency clinic, all of them survived.
Okay.
So if you take them in, chance of survival is great.
Yeah.
The ones that developed the kidney issues, it depends on how severe it is, but the ones that develop the severe, only like 53% survive.
Oh, okay.
Yeah, which is not great. But if you can get them to vomit, then you can hopefully decrease the amount of kidney damage.
Yeah.
If you can keep them on fluids, you can decrease the amount of kidney damage.
Gotcha.
Which fluids? Vet clinic.
Yeah. And this is IV fluids, not sub-Q.
Yeah.
Sub-Q does nothing in this case.
Right.
I mean, it does something, but...
And this isn't Pedialyte in the mouth.
Yeah.
This is like hooked up to a catheter on machines.
That go beep beep?
That won't stop beeping and drive all of us crazy. I hear it in my sleep. And then there's always pancreatitis, which is like its own book.
Yeah, we should do that next episode, because that gets into a lot of holiday cooking.
The pank titties is like the pank. This is like pankin. It's like...
The pank is pankin.
It's like... Well, and there's so many new developments. It deserves its own time.
That's true.
And it happens so frequently. Like, everybody either has a dog or knows a dog that's gone through it.
Yeah, and we're pretty much gearing up for, we'll probably have one in at least once a week.
Oh, I've had 3 of them this week already. And
really?
It's Thursday.
Wow.
Yes.
Goodness. But yeah, that'll be a whole nother
yeah.
topic.
We'll do that next.
Yeah.
Tune in for pink titties.
Tune in for the pancreatitis. So, but yeah, guys, that was just a quick overview of kind of what to watch out for. We've got Halloween coming tomorrow. Happy Halloween, everyone, if you celebrate. Stay safe in the streets. Stay safe with your pets. Stay away from feeding your dog sunscreen and diapers.
Gross.
And of course, if you have any questions about things, give us a holler. We are on Instagram. You can hit us up on Spotify. We are also on YouTube. And you can always send us an email, drmollydvm@gmail.com. And I hope you have a spooky Halloween.
Make good incision.
Thank you for joining us on Tales from the Clinic. Again, we are your hosts, Dr. Molly and regular Ashley. For more insider scoops into the vet med life and pet ownership, hit that subscribe button for updates on new episodes, and of course, share our channel to spread the word. Check the podcast notes below to see how you can get in contact with us. You can find all of Dr. Molly's affordable pet healthcare clinics on social media as well. Thanks again, and talk soon.